thank you so much. Thanks for Joe and Liz for organizing this exciting day, and thank you to Susan for putting together our panel and letting me use her laptop. So I'm going to talk to you about a question about whether it's possible that a cultural context of aging health, whether it's possible that we take in the stereotypes from our culture and they may have a direct impact on older individuals' health and functioning. And I thought I would start with an observation of culture from one of my favorite theorists, Erving Goffman, who's a sociologist who you, I'm sure, know about. And so he wrote a famous book called Stigma. And in it, he observes in an important sense, there is only one complete unblushing male in America, a young, married, white, urban, northern, heterosexual Protestant, father of college education, fully employed, of good complexion, weight, and height, and a recent record in sports. Any person who fails to qualify in any of these ways is likely to view himself, during moments at least, as unworthy, incomplete, and inferior. And what I thought was really interesting about this quote from Goffman is that the first attribute that he lists has to do with age. So he's observing that anyone who's not young, who's older, is likely to experience stigma or negative age stereotypes. And I would argue that even though he wrote this book over 50 years ago, these negative age stereotypes that are addressed at older individuals continue. So this is a figure from a recent study that we conducted using computational linguistics. And if anybody's interested, I'm glad to send you the paper that describes this in more detail. But basically what we did is we used something called the Corpus of Historical American English, which is a publicly available data set. So I'd encourage you, if anyone's interested, to work with it. It's actually very user-friendly. But what we were able to do with it is we created an implicit measure of negative age stereotypes and analyzed the negativity of age stereotypes by decade. And what you can see is that there is an increasing upward trajectory of the negativity of age stereotypes, and the best fit line for the negativity of age stereotypes was a linear trajectory. And as you can see, the stereotypes tend to be positive earlier, between 1810, and then they cross over at about 1880, and then they become, you see that they tend to be negative after 1880. About 90% of the data points that we looked at tended to be negative after that time point. So what do we know about these age stereotypes that exist in our culture? So from a number of studies, we know that most age stereotypes that people first think of tend to be negative. We also know from research that Palmore's conducted that about 77% of Americans who are 60 years and older report experiencing ageism. On the other hand, the good news is that most people are aware of the positive age stereotypes that exist in our culture as well. And also we know from a number of cross-cultural studies that there are some cultures and some subcultures that tend to hold more positive age stereotypes, which I think suggests that it's not inherent that we have to have these negative age stereotypes, that we can shift to these more positive age stereotypes. And so some of the cultures that we've looked at are mainland China and the deaf American culture, are cultures that we've found that have more positive age stereotypes. So what I'd like to do in my remaining minutes is, this is what I was asked to do, so I'll see if I can do it, is talk about an existing study that I think maybe sets up some questions, a new study, and then also I'm going to throw out some questions that I think might be interesting to think about in going forward with future research. So I thought I would start with a framework that I have found useful in thinking about how these age stereotypes may operate. And this is looking at previous research, but also thinking about what are some of the questions that we might want to ask going forward. And so this framework is called the stereotype embodiment theory, and it's the idea that we've taken these stereotypes, they're assimilated from culture, that these can lead to self-definitions, and that those in turn can influence functioning and health. And I'm going to give you an example of a physical health outcome study and a study that has a cognitive health outcome study. And one thing that's important to think about in how this embodiment takes place, how we think about it, is it operates in two directions. So one direction is from top down. So from the culture, people take in the stereotypes of their particular culture. We know that can happen as young as age 3 or 4. The children already know the stereotypes of their culture. And it also happens over time. So we know that it starts in childhood, and then these stereotypes tend to be reinforced over time. So the first study that I'd like to present is a little bit the older study. So this is a study that we actually, so in previous work we had been looking at whether older individuals, the stereotypes that older individuals take in, whether those influence health and health outcomes. But the thought is, if in fact these stereotypes are taken in at a younger age, that we should be able to look at younger individuals' age stereotypes and see whether those correspond to health outcomes in later life. And so this is a question that we asked with the Baltimore Longitudinal Study of Aging. What's nice about this data set is they recruit people as young as age 18. And they have an age stereotype measure, which is called the Attitude Toward Older Persons measure. And it includes 16 items. And so an example of an item is old people are absent-minded. In this study, our outcome was cardiovascular events, which was heart attacks and strokes reported by hospital records. And we thought this would be an interesting outcome to look at because in laboratory research we found that age stereotypes relate to cardiovascular response to stress and also to health behaviors. And others have found there's a lot of research that shows how health behaviors are related to cardiovascular events. So in the study we were also able to include all the covariates that we thought might be involved in the process. And so this is our finding. So this, on the y-axis, it's the percentage of individuals who have a cardiovascular event. The x-axis are years from baseline to first cardiovascular event. The blue are those who had more negative age stereotypes and in younger adulthood. The red are those who reported more positive age stereotypes in younger adulthood. And what you can see is that there's a significant greater likelihood of experiencing cardiovascular events among the negative age stereotype group. Or another way to think about this is that we found that younger people with more negative age stereotypes were twice as likely to experience heart problems after the age 60 than those younger people with more positive age stereotypes. So the more recent finding that I'd like to present is a study that just came out a few months ago. So we looked at whether age stereotypes are associated with Alzheimer's biomarkers. And we thought this might be particularly interesting because these stereotypes themselves, if they are a culture-based environmental risk factor, we also have some evidence that they're modifiable, so it seems like an interesting question to look at. The reason that we thought that there might be a relationship between age stereotypes and these biomarkers is that, as I mentioned, we have a previous experimental study that found that age stereotypes predict stress, and we also have some research that suggests that age stereotypes predict cognitive patterns over time. Others, Bruce McEwen and his group, have found that in animal studies that stress can contribute to pathological changes in the brain. And I also came across this interesting study that looked at, it was a cross-cultural study of Alzheimer's that found that rates of Alzheimer's is significantly higher in the United States than in India. And although the authors looked at nutrition as the possible explanation for this, it's possible also that age stereotypes might have something to do with it because there's also some evidence that stereotypes may be more positive in India. So in this study, again, we used the Baltimore Longitudinal Study of Aging. We used the same predictor that I just mentioned that we used in the cardiovascular study. In this study, the outcome was the Alzheimer's disease biomarkers. And so there are, we were able to look at decline in hippocampal volume because they included MRIs repetitively on the participants over 10 years. Every year they came in and gave MRIs. And then also a good number of participants in the BLSA have kindly donated their brains to science. So we're also able to look at plaques and tangles by autopsy. And something that's good about this study is also the age stereotypes were measured in dementia-free and physically healthy participants. So it was decades before they showed any brain changes that they reported their age stereotypes. And again, we tried to include relevant covariates that we thought might have an impact on these cognitive outcomes. So this is our first finding. So this is the outcome of hippocampal volume over time. So the y-axis is the hippocampal volume, the x-axis is the yearly MRI measurements of hippocampal volume, and as you can see, the green are the positive age stereotypes, the blue are the negative, and as you can see, those who had more negative age stereotypes showed a significantly greater decline in hippocampal volume. And this is our second finding, looking at plaques and tangles based on brain autopsies. So the y-axis is how negative their age stereotypes are, and then the x-axis are the severity of plaques and tangles, and we did find a significant relationship between how negative their age stereotypes were at baseline and the severity scores of plaques and tangles. So in summary, these different studies suggest that cultures do have both positive and negative age stereotypes, that they can be assimilated at a young age, and that these age stereotypes may contribute to physical and cognitive function. And I'm going to present the questions in a minute, but I just want to make sure that I don't forget to acknowledge the generous support of National Institute on Aging and Health from Listening, putting these studies together, and also our collaborators on each of these studies, so Luigi Ferrucci, Susan Resnick, and Alan Zonderman, who are at the NIA intramural group, and then Marty Slade and Juan Trancasco, who are at Johns Hopkins, who help with the brain studies. Okay, so questions for future research. So, some of the things that I thought about that we might want to think about in going forward. So one is actually, what is the origin of these positive and negative age stereotypes? So what I just want to mention is the corpus of historical research. There's some questions about where do they actually come from? And then, what are the historical forces that lead to these changes in age stereotypes? So both the overall trajectory, but there are also these interesting little bumps in different decades that are really interesting to think about. And I've had people throw out different speculations about what might be happening, like the Great Depression or different things that might actually have an impact on age stereotypes, which I think are important to think about. Another question I think that's important is what is the pathway that allows these age stereotypes to contribute to health and functioning in later life. So we've looked at a few different types of pathways, but I think there's a lot of research that remains to be done in this area. And then lastly, what is the best way to intervene with children to focus on prevention of negative age stereotypes and bolstering positive age stereotypes? So as we know that the stereotypes are taken in at a young age, wouldn't it be great if we could go into preschools and kindergartens and find ways to really make sure that they're taking in positive age stereotypes as much as possible? So thank you.